Hello, Bay Area. Good morning. You are listening to Radio Mirchi 1310 AM. Do not confuse this. And this is your one and only RJ Mirchita right now, knocking at your door and waking you up. Wakey, wakey. And good evening to people in India and other parts of the world. I have come back today with our COVID awareness show, day 70. I cannot imagine that we have completed literally 69 shows and आज है हमारो I think 70 divas, which is 70th show. And a lot of girls were like literally requesting me, okay, you have done this fitness show and you are doing this, all other doctors and them, IVF and all this cool stuff. But hey, I'm really worried about my hair, skin, nails. And I was like, એ તો હવે બધાનો રોજનો પ્રોબ્લેમ છે યાર. તમે ગમે એટલું ખાઓ, તમારા વાળ તો ખરવાના જ. And do you guys know the highly searched thing on Google was how can I stop hair fall? How can I protect my skin? And I was so shocked कि लोगों ने भले fitness करे, health करे, they jog, they walk, but the most important thing is, hey, how can I be aesthetically beautiful? Like externally beautiful, So it is matter. It does matter for a lot of people and actually for all of us, right? Presentation is the key. કેમ આપણે આઈફોન વાપરીએ છીએ? નોકિયા આપણે નથી વાપરતા હવે, right? છે જ નહીં actually નોકિયા કહે તો તમે વાપરો કઈ રીતે, right? But there are all other phones and made in China and all that. We all know that, but આપણે નથી use કરતા. We are always going and opting for iPhone. So the beauty of today's show is it's going to be very, very beautiful. You know why? Because we are having a dermatologist and a cosmetologist both all in one. એટલે કે આમ એમના કે એક પેકેજમાં આપણને એક ગેસ્ટ ડોક્ટર આવ્યા છે આજે, who is with us along with Dr. Modha, and his name is Dr. Chetan Lalseta. So like I was telling, yeah, it's all in one, right? So today's show is going to be very, very beautiful for all the beautiful ladies and gentlemen out there. So let me introduce and tell a little bit about Dr. Chetan Lalseta. He completed his MBBS in the year 1999 from Ampisha Medical College at Jamnagar from Saurashtra University. Then followed by his MD, he did in Skin and VD in the year 2002 from Guru Gobind Singh Hospital and Ampisha Medical College, Jamnagar, again Saurashtra, which is in Gujarat in India. Currently, he is working as a private practitioner, as a consultant dermatologist, venereologist, and cosmetologist at Shraddha Hospital, Rajkot, for last 17 years. Oh my God, that's quite a lot. As a panel consultant at Wokat Hospital and at Sterling Hospital, Rajkot, for last 13 and 7 years again. Again, he's working as a visiting faculty to all multi-specialty hospitals at Rajkot, like Sri Giriraj Hospital, Synergy Hospital, and so many. આપણે પૂછશું ડોક્ટર ચેતન કે તમે બધી જ હોસ્પિટલમાં કન્સલ્ટન્સી કરો છો, તમે ટેલી કન્સલ્ટન્સી કરો હવે. We all need it. All the beautiful ladies out here are just like, yes. And also working as a panel consultant on Accountant General AG Office, Rajkot. He also is ex-visiting dermatologist at Sri Ram Hospital. He worked there in Gondal for 7 years. He also worked as an honorary lecturer in Rajkot Homeopathic Medical College, RHMC, and KK Seth College of Physiotherapy for last 17 and 7 years. Well, like I tell you all the time કે હું જો ઇન્ટ્રોડ્યુસ કરવા બેસીસ બધા ડોક્ટર્સને મારા બુક્સ લખવી પડશે ખાલી ઇન્ટ્રોડક્શન ઉપર યાર, અને એક એક કીવર્ડ ઉપર જે એમનું સ્પેશિયલાઇઝેશન છે. Also, let's continue a little bit. He presented scientific papers and posters at various state conferences, and he was awarded first prize for poster presentation on cutaneous B-cell lymphoma at IADVL State Conference in Daman in 2001. He has published scientific articles in various journals of IMA, local as well as FPA branch, participated in more than 200 diagnostic camps in various districts of Saurashtra region in association with government bodies and several NGOs. He has published various articles in newspapers, local magazines, and delivered, hey, important thing, radio and TV talks on public awareness regarding dermatology, cosmetology, and most importantly, HIV and AIDS. He's also very active member of various medical associations like હું તમને કહેતી જ હતી, IMA and IADVL. And most importantly, he was president of IMA Rajkot in 2019 and 2020, just recently. Director of SHMS Shraddha Hospital Management Solutions, and he assisted in various multi-specialty hospitals of Rajkot as an NABH consultant. We did a show on NABH, right? You all should know now what is NABH. If you don't know, go to the channel and look and check out for NABH special show that we did, and that was through SHMS consultancy. So this was a little bit really about our today's who I'm going to handsome doctor, dermatologist and cosmetologist, Dr. Chetan Lalseta. So I welcome him on the show. But now it's time to invite the most popular doctor of Rajkot. I think now he is even getting popularity here in US and I think Australia too. કારણ કે એમનું favorite city છે, favorite country છે Australia. So we will invite now surgeonona surgeon and Bhishma Pitama of surgery plus founder of Gokul Group of Hospitals, which is Dr. Modha to come and share with us COVID statistics, એટલે world COVID statistics, India COVID statistics, Rajkot, Gujarat, અને આપણે વાત કરીએ vaccine and mucormycosis. So let's ask Dr. Modha and welcome kariye Dr. Chetan Lalseta on the show. Welcome, Dr. Modha. Dr. Chetan.
Yeah. Good evening, listeners in India, and good morning, listeners in US. I welcome Dr. Chetan Lalseta, who is from Porbandar, and we are from Porbandar. So we are proud of you, Chetan. And now I will talk about few words in COVID statistics. Now it's a bad news for US. You know, the corona cases in US is increasing. It is 95,083 new cases. Yesterday it was 84,000. Today it is 95,083. And death is 389. So death rate has come down, but the new cases has increased. Similar thing for UK. New cases are 30,633. And yesterday it was 25,402. So there is also substantial increase in the new cases. But death is reduced. It is 85 new death. Now coming to India. It is total new cases are 44,230 and death is 555 new death. Going to Brazil, it is 42,283 new cases, but death rate is again high. It is 1,318.
Brazil is totally out of control. I mean, like
sometimes it's increase, sometimes, and actually, really, there is a problem in Brazil.
Yeah, something
so,
is.
The people are fighting for the vaccination. Some of the people, they don't want vaccination. They move without mask. So there is no control in Brazil, it seems. And now coming to my favorite country is Australia. There are 209 new cases only. Sorry, 205 new cases.
Okay.
And one new death only. So as far as COVID is concerned, I will always love to have Australia in my side. You see?
Yes.
And now coming to Gujarat. Total new cases are only 27 in Gujarat.
Mm-hmm.
And no new death. Zero death in Gujarat.
Excellent. That's great.
So, Ahmedabad, they have got 3 new cases. Surat, again 3 new cases. Baroda, 5 new cases. Rajkot, 0 new cases. No new cases in Rajkot. Jamnagar and Junagadh has got 2 new cases each. And Bhavnagar has got 1 new cases. So as far as corona is concerned, in Gujarat, it is receding and it is decreasing, and there are very few cases we are reporting. But going for vaccination now, counting the vaccination is increasing definitely in government as well as in the private also.
Excellent.
And but new cases in the state of Kerala and Karnataka is increasing.
Mm.
Practically half of the 44,000 goes to Karnataka and Kerala.
Oh my God. Do you
So
think it
this is
must be a
the
new variant? What do you suspect? Is it a new variant or
it is this Delta variant only,
only?
but some of the few cases belongs to Kappa variant.
Oh.
Kappa variant, we have one death in Gujarat
Uh-huh.
due to Kappa variant. And mucormycosis, if we consider, it is practically gone down a lot. We don't have our ENT surgeons very busy. Now they are moving around, not doing operation for mucormycosis. And overall, we are seeing now the complication of mucormycosis.
Hmm.
So this is the something change in our things. So with these remarks, I will request Mirchita to take over and ask few questions to our beloved Chetan Lalseta, who is a eminent skin specialist
Yes.
of Rajkot and is from Porbandar. So we must welcome him. And Chetan, good luck. Please tell us something new about the skin and COVID.
Sir.
Yes. So very welcome, Dr. Chaitan. I think a lot of people were excited to see you on the show because you know how a lot of girls out here, they just
Yeah.
like want to get into this topic right away. So I didn't want to take a lot of time, and I'll ask you the first question, which is, can COVID infection affect our skin?
So basically, first of all, I would like to thank Dr. Prakash Modha sir for giving me this opportunity to be live on this show, and I'm very much thankful to Mirchita for a very nice, comprehensive, and elaborative uh, description of my profile regarding the cutaneous part, skin.
Yeah.
Previously, it's approximately 1.5 years that we are here listening to this COVID.
Yes.
Disease which started as a respiratory infection in the preliminary phase. Later on, we came to know that it affects kidneys, it affects heart, it affects brain, and it affects practically each and every organ of our body. So, a localized disease turns out to be a systemic one, and practically every organ is affected. Now, we know that skin, it is the largest organ of our body. Okay, whatever you see externally, that's skin, and it comprises approximately 17% of your body weight. Okay, from
Wow.
head to toe. So it includes hair, it includes nail, and it includes the outer skin, which is visible to us. It is not only the visible part, but the layers of skin, which is a part of cutaneous appendages that contribute to this weight of 17%. I would like to have one small presentation of various changes that occurs in the skin because of the immunopathology of COVID.
Mm-hmm.
Uh, when the COVID pathology was being investigated, then it comes out to be vasculitic changes, and the manifestations are due to the inflammatory markers and the inflammation which it causes in different organs, and skin is no bar to that. So the changes which are skin in COVID infection, we can broadly divide it into three types. Okay, one are the infections which are practically due to COVID infection itself, which can be considered or seen during the COVID infection. Second one is post COVID stage, where a patient develops few changes in the skin, hair, and nail after 3 to 6 months of COVID infection.
Uh-huh.
And the third part is due to vaccine, because the vaccine which is used to control or prevent the COVID infection, it has also some of the cutaneous side effect, we can say. Not necessarily all may be harmful, but those changes are also evidently seen, which we should be aware of not to be frightened of vaccination, but we should be aware that these are the changes which can develop due to vaccination also. So I would like to talk about all these three factors one by one gradually. The first part is the changes in the skin which occurs due to COVID infection and during the COVID infection. So for that, I would like to share one presentation, a small presentation with some scientific words containing the pathogenesis of what it develops and few pictures how it looks like actually. So that may be helpful to many of my medical colleagues also, and at the same time, some common people also will come to know a few things about the change. So I am just sharing that small presentation, and then we will continue with our discussion. So these are the skin manifestations related to COVID, which I would like to share. Now we all know that this COVID-19 is it's an ongoing global pandemic which causes SARS-CoV-2, that is severe acute respiratory syndrome caused by this virus, which was first isolated or still we are not sure from where does it originated, but still we presume that it originated from Wuhan, China in December 19. The common symptoms which were confined to the respiratory system, that includes fever, cough, fatigue, dyspnea, and hyposmia. But amongst the extrapulmonary signs, means other than the respiratory symptoms, we have a cutaneous association which is reported in last few months and it is increasing. So these are the list of the changes that occurs in the skin actually due to the COVID infections. So the polymorphic nature of the COVID-19 associated cutaneous manifestation includes some group of symptoms that includes urticarial rash, confluent erythematous and morbilliform rash, papillovesicular exanthematous rash, chilblain like acryl pattern where patient feels that their fingertips and the toenails they have turned blue. Okay, then Leviton Reticularis like pattern, purpuric vasculitic pattern, which could be severe, which could be sometimes life threatening, exaggerated herpes zoster. Herpes zoster, again, it's a common viral infection which occurs in a normal person also. But here, due to this COVID, there may be exaggerated herpes zoster lesions. Mottled skin, the pigmentary changes in the skin which occurs in a diffuse pattern, which are not attributed to any other causes. Okay, patient feels that their skin color has changed dramatically. And specifically, when we talk of the facial skin color, most of the time we are still covered with the mask. Okay, so we have been not able to give the more importance to the facial color, but still after this so much long duration, we are seeing some periorbital dyschromia, means periorbital hyperpigmentation, આપણે જેને કાળા કુંડાળા કહીએ જે આંખ નીચેના, they are very much evidently seen in this COVID infection. So the urticarial rash, જેને આપણે સાદી ભાષામાં સીડસ કહે, it's a type of allergic manifestation which is seen in approximately 16 to 17% of the COVID patient. So it is one of the most commonest presentation which is seen. It is associated with severe itching. Patient feels restless and irritable, and in most of the time these lesions are involving the trunks and limbs, and these are ranging from small size lesion to the larger lesions like this. So you can see the pictorial view of how the lesions look like. The lesions, though they look like severity enough, but they are benign lesions. They are not going to cause severe harm to the patient, but definitely patient has severe itching and discomfort. Second one is urticarial vasculitis. Now these changes develop as a part of severe inflammatory response. Okay, and as a result of which they develop painful itchy inflammatory conditions which may be widespread, which may be confined to whole of the body. These symptoms, they can easily be controlled with antihistamines and low dose steroids, so that should not be a problem. One good thing regarding the cutaneous manifestation, I would like to emphasize that we need not treat all the cutaneous manifestations because they are part of the spectrum of the inflammatory changes which occurs due to COVID infection. And as we treat the primary disease, these changes will subside on its own. So it is not necessary to treat each and every red color mark which is seen on the skin in COVID. So that should be a sigh of relief for the patients. Then we have erythematous, maculopapular, and morbilliform like rash, which are very commonly seen in other viral conditions like pityriasis, rosea, and measles, rubella. So same types of symptoms are again seen in case of COVID infection also, because it's also a viral infection. Now, in most of the cases, these lesions are generalized. So whole of the body is affected and it's a symmetrical. So patient feels that something unusual has happened to them, something severe has happened to them. Because see, the infection which affect the lung, which we are not able to see clinically from the naked eye. We can get CT scan done and we can assess the severity. Okay. But the cutaneous changes are more markedly seen with the naked eye. So that definitely is a cause of concern for the patient and for the surrounding also. Okay. So these are generalized symmetrical lesions which may start from face and then gradually progress to involve the trunk and the limbs. See, this type of lesions are seen in many of the patient, and they are seen even in pediatric age group also, because pediatric COVID infection is also again very common, that may be contributing approximately 8 to 10% of the patients. A good thing is that they respond very well to the topical corticosteroids, and very rarely systemic corticosteroids may be required. And this type of varicella means chickenpox. So chickenpox like lesions, papillovesicular exanthematous lesions are also seen, which can be part of the COVID manifestations in the during the COVID phase or post COVID phase. So this type of lesions, varicella like lesions over the seen over the trunk, abdomen, and they dry out and they form crusted lesions. They are painful, itchy, and inflammatory, but they subside with routine topical antibacterials and through the calamine lotion. So need not worry. Just wait and watch strategy will heal majority of the cutaneous manifestations in COVID. Chilblains like acryl pattern. Now, this is something which is to be given a due consideration, because that are suggestive of cytokine mediated inflammatory response, and it indicates some endothelial damage, and as a result of which it causes microangiopathy and coagulation abnormality. So, if not taken due care, then sometimes it can lead to gangrenous changes also. So, this chilblains like lesions, okay, this type of lesions, you can see the redness in the fingertips and they are painful. Generally this type of lesions we develop environmentally when we are exposed to very low temperature. Okay. This type of changes are due to microangiopathy, where the blood vessels, they undergo severe vasoconstriction, they are not able to have an effective vasodilation, and blood supply is hampered. So that produces this type of painful lesion, so they require due care. Then we have this Leviton Reticularis like racemose type pattern, where cobweb type lesions may develop, and they subside on its own with routine symptomatic treatment, and most of the time they are asymptomatic, but only the pattern which we see over the abdomen or over the limbs, that may be a cause of concern to the patient. These are physiologically seen in many obese patients also, so not necessarily that we need to link with every time with the COVID infection. Okay, there are various other causes for this type of presentation also. So this type of pigmentary purpuric patches also is seen in COVID infection. So the next presentation very commonly seen is purpuric vasculitic pattern as a result of the microangiopathies and the dysregulated inflammatory response. It causes vasculitic pattern, which could be localized, which could be generalized, and can involve even symmetrical limbs and cause even hemorrhagic blisters also. So this type of lesions. Now these are painful lesions. These are uncontrolled and progressive type of lesions, and their quantitatively the lesions are symmetrical with the severity of the infection. So routine investigations may be required to assess the severity of the infection, and we treat the primary infections and they get cured on its own. Herpes zoster, as I told you, that exaggerated herpes zoster, generally it's a benign infection which affects a single part of the body, and which generally subside within 7 to 10 days. But here we see that it could last for more than 4 to 6 weeks with more severe painful lesions. And the pain may be troublesome, affecting the quality of life of the patient, even in a long COVID or post COVID stage. Typically, this mottled skin appearance we see in case of pediatric age group. Okay, so neonates, we find, see, you can see this pattern. So this is the type of mottled pigmentation which we see in neonates specifically, and in this era, we should test them for COVID infection, and it is found to be positive in many of the patient who is presenting with this type of cutaneous changes. As we talk of the face, the most important and the most attractive part, that is face. So
Yeah.
periorbital dyschromia, this is a very any slight change of color is of concern to every, we understand. So periorbital dyschromia for no reasons. So this type of changes, pigmentary changes, you can see this periorbital hyperpigmentation. And we ask the patient, are you exposed to sunlight? They say we have been indoor for so many months and still this is developing. So while taking detailed history, when we ask them, definitely there is a strong history of COVID positivity, and these are the changes which we see very often, specifically in teenagers and young age rather than the old age. This type of changes are seen. Of major concern, as you told in the beginning, is regarding the hair loss, severe concern to majority of the females, teenagers in this COVID era. uh, and at present we are seeing maximum involvement of hair as a post COVID manifestation.
Oh,
Scientifically it is known as telogen effluvium. Patient comes containing bags of polythene filled with their hair fall, just to help us to assess the gravity of severity which they are facing. They just comb the hair and it's full of hair. Okay, it's
oh,
true. It's not only with the COVID infection. It is seen with many of the infective condition like typhoid, malaria. In the post febrile phase, this type of hair fall is common. But since COVID has affected a large population, so that's why we are seeing a large number of patients with the telogen effluvium at this point. Basically, the hair roots, they shed off. Hair growth and hair fall is a cyclical phenomenon. Okay, so the hair cyclically shed off and new hairs are continuously being growing. So that's an anagen phase, telogen phase, and catagen phase. But here what happens, due to
hmm.
this COVID infection, this anagen phase of the hair, which is a relatively longest period, the hair transit from anagen to telogen phase, and they shed off. And they shed off with a slight trauma, slight routine physical activity, hair washing, hair combing, and they shed off. So this telogen phase lasts for approximately 3 months. So we should ensure the patient that don't worry, you will not get bald, because many of the time female patients come with a tuft of hair. And when we try to reassure them that don't worry, within 1 to 1.5 months you will be absolutely fine, they say that, sir, with this pace, if the hair fall continues, I am doubtful whether after a week any hair will be there on my scalp or not. So
Yes,
this,
that is a concern for all across the world, not just in India. Dr.
yes,
Modha, any comments you have over there?
Yeah, this is
yes,
very common problem, and that's why they try to move around with the doctors. You see, સાહેબ એટલા બધા વાર ખરી ગયા હવે મારો શું થશે they worried. એટલે
so
ચેતનને મૂકીને બીજા પાસે જાય, બીજો આનો ભાઈ જ હોય, છેલ્લે ફરી ફરી ચેતન પાસે આવે. This is the mentality of the people.
here one good thing is that the last treating doctor will be beneficial, because
Yeah.
because the hair, see, it's a cyclical phenomenon. Okay, only thing is we have to give time. That phenomena will last for 3 to 6 months after the COVID infection. Okay, so that doctor who treats during the 5th to 6th month, he will be given due credit of treating them. but it is going to get cured. So patient should not be worried about whatever may be the severity. It's a cyclical phenomena and the disturbances in the physiology which is leading to this pattern of hair fall. So about 80% of this patient who treated with systemic corticosteroid, hydroxychloroquine, antibiotics, and severe COVID infection, they end up with this type of condition. So see, this is the severity which we see in terms of hair fall, and there is a typical demarcation and separation of the hair lines. And when we examine them, when we look them with dermoscopy, we also see that there is a reduced density of the hair or the scalp. So their concern is literally genuine. We should not ignore them, but definitely we need to counsel them and we need to treat them. We need to supplement with them with the adequate protein and nutraceuticals which will help them to gain or regain the hair within due time, and with just routine dietary improvement and a supportive care, definitely every patient of telogen effluvium will have normal hair restoration within 3 months. So they should not be worried about this hair fall. So that was the small presentation
Uh-huh.
which I would just like to share regarding the cutaneous manifestations and the dermatological presentation of COVID infection. So this is during COVID and short COVID, post COVID. So these are the changes which we are commonly seeing, and these are not the severe life-threatening condition, but definitely they are of concern, because once the fear of COVID has gone, patient has suffered from the COVID, they are relieved once they've recovered, they feel that now they will not develop COVID, at least. Okay, so that stress part is also playing a very vital role in this hair fall, because stress definitely aggravates hair fall to some extent. So I think this presentation would be helpful to many of the people who are online for this show, and they will be relieved at least that they should not be worried seriously about the cutaneous changes.
Already?
Good,
Doctor,
very good.
yes.
Yes, excellent presentation. People do
Thank you, sir.
worry about the hair fall. Always, and particularly ladies. Oh, મારો વાળ વયા ગયા, મારા વાળ વયા ગયા. કંઈક કરો, કંઈક કરો. તમે મને
એમાં
ડોક્ટર પાસે લઈ જાઓ.
એમાં શું છે સાહેબ, માસ્ક પહેરી પહેરીને ચહેરાનો કન્સર્ન તો ઓછો થઈ જ ગયો, તો વાળ દેખાતા હતા, હવે એમાંય પ્રોબ્લેમ થવા માંડ્યો, હવે શું કરવું?
But a lot of people in US have complained that wearing mask is making their nose irritation, breathing
Yes,
irritation, and they are developing something here on the side, on their
mask
face.
acne. So there is a terminology which has emerged, maskne. Okay, so it's mask induced acne. Okay, because of the continuous wearing of this N95 or tight mask, definitely it affects the sebum production and it causes pressure changes. So definitely they are going to cause this type of transient changes, but one should not be worried about that. With a due routine facial hygiene, like cleaning the face 3 to 4 times a day, will definitely help them.
Okay. So we can
Very good.
ask you some questions, right? So COVID does infect and affect your skin, that
Yes.
is for sure. So I don't know if we covered this one. What are the common immediate and long-term changes in the skin due to COVID infection?
Yes, yes. A few things we have already covered in the presentation. The immediate changes we have emphasized and shown by photographical way also. But long-term changes are definitely because COVID causes some form of immunological abnormalities secondary to the inflammation. We are literally worried that it may trigger many of the other autoimmune disorders. Okay, we are seeing flare up of psoriasis, we are seeing flare up of vitiligo, we are seeing flare up of systemic lupus erythematosus. These are all autoimmune disorders which affect the skin. Rheumatoid arthritis, diabetes mellitus, thyroid disorders. There are other systemic disease which can also be triggered or aggravated due to the COVID infection. So, for all those who are already suffering from autoimmune disease, definitely COVID may act as a trigger for exacerbation. So, they should be little more cautious in the treatment part. And again, they have already been on treatment for autoimmune disease, so they may be taking immunosuppressive agent. So their immunity is already compromised. So they need to take care of their immunity by some immunity boosters, and at the same time taking care of their diet, lifestyle, and relieving the stress factors, which will help them to come out from this situation at earliest.
Yes, Dr. Modi.
Chetan,
Yes, sir.
Chetan, uh, they said psoriasis can caused by the hepatitis C virus.
Yes, yes, sir.
So, so it is not an autoimmune disease.
Sir, it is an autoimmune disease, but it can be triggered by any infection, and specifically in hepatitis C is one of the major virus causing flare up. Psoriasis is whatever the manifestation of psoriasis are due to the inflammatory changes. Okay, so it is an autoimmune disease, but the triggering, their exacerbation depends on variety of factor, and we are seeing many patients who have hepatitis C and flared up psoriasis.
Yeah, that's right.
A lot of times, thanks Dr. Modi and Dr. Chetan, a lot of females, COVID to humna aa gayo, right? COVID is just now. But even without COVID, I remember that a lot of people were really looking for some cure to make their nails beautiful or have a very long hairs and very beautiful hairs. So uh, let's say if somebody gets COVID and they shed their hair, or they're having some this kind of illness, then is it curable? If so, how, and how much time it's going to take? As you said, it's a cycle.
Yes. See, basically, hair and nail, they share a common base of, they both are made up of dead proteins. Okay. Nail is also made up of dead protein, and hair shaft is also made of dead protein. They are made up of keratin. Okay. So, when any disorder which affects this hair and nail, and when we want to, other than the infectious disease, okay, when we are taking care of this, we should be focusing on the proteins which will help to regenerate this hair and nail from the roots. Biotin is one of the major ingredient of this hair and nail. So taking an adequate amount of biotin in diet, either in forms of supplement, in forms of tablet, which is available in 5 and 10 milligram strength, will be helpful for 3 to 6 months. Definitely, it will help to regain the and restore the amount of biotin which is depleted. Second one is calcium. Calcium is an element which is giving a strength to the hair and nail. And specifically, see, in calcium, we have different types of salt: calcium carbonate, calcium oxalate, calcium phosphate, and calcium pantothenate. Specifically for hair and nail, it is the calcium pantothenate salt which is very effective. Okay, so many a times patient feels that we are taking enough of calcium tablets, we are taking so many supplements, still we are not feeling the relief. But definitely the biochemistry makes a difference. So those who specifically want to have their good hair, good nails, they should consume the calcium pantothenate salt, or they should focus on a diet which is rich in this type of salt. Okay, so milk is one of the basic ingredient which can give adequate amount of calcium. Second one is cheese. Okay, many teenagers will definitely love it. Okay, so cheese is a good source of calcium. Amongst the seasonal fruit, mango is again a very rich source of calcium. And for proteins, the sprouts are the major source from the vegetarian diet. Or non-vegetarian diet, egg, meat, they contain, or cod liver oil, they contain adequate amount of proteins which are very very beneficial for hair. Specifically, આપણે જે કાળા તલ કહીએ છીએ ને, black
Yeah,
gram, so they
yeah.
are the richest source of protein for hair and nail.
The
Okay.
blackberry.
Yes, yes. So you can consume it in any good form, whatever you may like. Okay, and they are very rich source for protein, for specifically for hair and nail, and they have to be consumed for at least 3 to 6 months to have a beneficial effect. It's not that we consume for a week or fortnight and we start seeing the effect. No, body's mechanism will take a little longer time to set to the this dietary changes. So at least for 3 to 6 months, you give adequate time, and definitely they will work.
Excellent. Thank you. So next question I think I have for you is any vaccine induced skin changes, because we all have
Yes.
taken vaccine.
Yes. There
All
are
of
different
us.
types of vaccines in different parts of the world. Okay, so
Yeah.
all vaccines have their pros and cons. All vaccines have their different efficacy ratio and all that. Fine, we don't discuss about those things, but definitely vaccine induced changes can be immediate type of changes or delayed changes. In the immediate changes, local inflammation, pain, fever, these are all routine symptoms which majority of the population develop, and they get rid of it with simple analgesic or antipyretic for a day or two. Now, in some cases, vaccine induced arthritis, vaccine induced reactivation of lymph node, vaccine induced hair fall, vaccine induced stomatitis, and there are few instances where vaccine induced drug reaction. Specifically, it is for those who are sensitive to vaccines. Okay, there are two incidences where they have developed a severe type of drug reaction. We call it as a Steven Johnson syndrome, SJ syndrome. Now, it is a life-threatening condition. Okay, which occurs as a very rare complication of many drugs, and due to vaccine also there are spotted incidences. So one should take detailed history. If patient has a past history of any drug reaction, definitely we should overview them more thoroughly before giving any vaccination. But looking to the changes or the complications which occur due to vaccination, compared to the risk benefit ratio, definitely they are very negligible. So one should not refrain themselves from taking vaccine. Okay, but one should be conscious about the changes which occurs in a post vaccination phase.
As long as vaccine does not impact our nails and hairs, we are good.
Yes.
Vaccine can impact other things is okay. We have cure for all that. We have all specialists. But for hair and nails, I think when we talk to the doctors, they're like, we can't help you. That is the only thing is not curable.
Really.
Next question I have is general precautions to prevent long-term skin changes.
Yes. See, these are very much essential because once we are getting restored to the normal routine life, okay, after infection, after COVID, these are the cyclical phases. Okay, second wave, third wave, fourth wave. Gradually, this pandemic is going to get converted into endemic or epidemic stage. Okay,
Yeah.
because we don't expect this virus to go away completely. It's practically not possible. Okay, our sensitivity to this virus infection will gradually decrease once we reach to the level of herd immunity or complete vaccination. And in those stages, when we are coming back to normal, we would be very careful, cautious about our routine lookout. So to prevent the long term skin changes, we should focus on the nutraceutical nutrition. That is the basic. So taking an adequate amount of vitamin C in diet. Okay, I'm not talking that everybody should consume medicines. Okay, it's not necessary. Generally, we get everything from the diet. Okay, so our dietary pattern, our dietary ingredients should be such that it contains adequate amount of all the required, and that's why Gujarati diet is considered to be a balanced diet. Okay, because it contains everything required in for replenishing each and every organ. So adequate amount of vitamin C from the citrus fruits, so lemon, amla, pineapple, orange. These are rich source, and everybody loves to have all these things. Okay, so definitely vitamin C works as an immunomodulator. It helps in boosting the immunity, and it also helps to keep your skin glowing. Okay, so consuming, and it's a water soluble vitamin, so even if you consume in excess, it is not going to cause harm.
Yeah.
Good amount of protein in diet. Okay, quantity is not important, but daily consumption, that is important. Okay, on one fine day you consume half kg of protein, and then you don't consume for a week. That is not the ideal way. Okay, it's better to consume 25-50 gram of protein. According to body weight, its per day requirement is 1 gram per day. Okay, so approximately that much amount of protein if we consume daily, that will definitely help to boost our immunity and will keep our skin, hair, and nail integral.
Already. Thank you, Dr. Chetan. I think this is our last question, which is any specific investigations required to diagnose skin disease due to COVID? ખબર કઈ રીતે પડશે કે શું થયું છે સાહેબ?
Our branch is a purely clinical branch. જે દેખાય ને એ જ સાચું. Okay. And there is a dictum that eyes do not see which mind does not know. Okay. આપણને મગજમાં હોય કે આ વસ્તુ હોઈ શકે તો જ આપણને ઈ દેખાવાની છે. Okay. But still, there are certain limitations of what we see. So definitely they need to be confirmed. So routine investigation, complete hemogram. Many times what happens, there may be other associated condition. જે પેશન્ટને એનિમિયા હોય, હિમોગ્લોબિન લેવલ લો હોય તો એને કારણે પણ સ્કિન ચેન્જીસ થઈ શકે. So to differentiate it from the COVID infection, many times baseline investigations are necessary. So routine CBC, એટલે hemoglobin, blood count, WBC count, that are mandatory. In some cases, nutritional deficiency may be there. So vitamin B12 and vitamin D estimation, that is also a very important investigations which may be required. And at times, when the skin changes are lying for a longer time, then we may need to take biopsy from the affected area and subject it for histopathology, and definitely it will reveal the changes of vasculitis or other changes of COVID infection, which will help us to confirm what we are seeing clinically. Okay, so these are the small things which may be required at times in 5 to 10% of the population, not necessarily in each and every patient.
Excellent, Dr. Modha. Any comments?
Yeah. Skin is a mirror.
Yeah.
Mirror, and you can see with your naked eye that this is this. And our particularly Indian dermatologists are such a vast experience they have got. So with just seeing the patient, they will come to the diagnosis that this is this. They don't need much investigation, and 99.9% they are right. Very rarely they miss the diagnosis. So
Yes.
it's the advantage of clinical way of diagnosis in India. But if you are in US, you will write thousands of tests and then come to no conclusion.
So, કેટલા હવે sir that question? So, if your ferritin levels get low, then you will shed your hairs more. Is that so?
Yes. See, serum ferritin basically it's a marker of iron reserve. Okay, so once the serum ferritin level is low, it means your body is not only anemic, but its reservoir is also getting depleted. Okay, yes, sir.
Yeah, her hemoglobin is 12 point something,
Yes,
but ferritin level is low.
10.
So I said either hemoglobin is wrong or ferritin is wrong.
I don't know what is wrong. It can't be possible, right? That your hemoglobin is 12 and ferritin is 10. So I just asked you this question. Okay, is there any possibility that I should, take care?
uh, yes, you should focus more on a diet which is rich in iron. Okay, there are many dietary sources, and again, not only the iron rich diet, consumption of vitamin C will increase the absorption of iron from the gut. Okay, so that is also equally important, and that's why there is a tradition of drinking a lemon water half an hour before the meal. So whatever we take in the diet, it will be absorbed more easily and more efficaciously.
Cool. Already, this was amazing show. I think I've learned so much, and a lot of us have learned so much. So thank you, Dr. Chetan,
Thank
and
you.
Dr. Modha, both. But
Yeah.
tomorrow we are having Swamiji on our show actually, right? Tomorrow
Yeah.
talk about
Paramahansa Swami from Munchka.
Yes.
talk about COVID and spirituality. So we look forward everybody to see you tomorrow, and it was a great show. And if you have any questions, then you can reach about hair, skin, nails. Please reach out to Dr. Chetan Lalseta, and his number is 98251 99585. I'm sure a lot of people will ping you personally for hair and nails for sure.
Welcome. Thank
Already.
you, and thank you, Buddha sir, for giving this opportunity. Thank you, sir.
Chetan, really it was marvelous information and very good way of teaching common man. You see,
Yes.
it will benefit a lot to them. So
Yes,
they
sir.
need not worried about, because people worried a lot when they see lots of hair fall, some skin lesion, they just frighten up. So
Yes, sir.
you have clarify the things in a simple way, and I hope that it has all gone into their minds and
Yes, sir.
help them to calm rather than worried. So,
Yes, sir.
with this remarks, I think we end the show.
Yes,
Thank
sir.
you very much, Chetan and
Thank
Ishita
you.
both. And tomorrow we'll welcome our Swamiji.
Yes, tomorrow
Thank
is
you.
a very special show, weekend special.
Yeah.
Thank you,
Okay.
everyone.
Bye
Bye.
bye.
Thank you. Bye.
Bye bye.
Bye.